serve as chairperson for the Kansas Behavioral Sciences Regulatory Board. I ask that the members of the board to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic medium. David Anderson.
Present.
Jacqueline Lightcap.
Here.
Jonna Norton. Bruce Nystrom.
Here.
Leslie Seawester.
Here.
Laura Shaughnessy.
Here.
Rick Steele.
Here.
Carolyn Zespran.
Here.
Don't believe Mary Jones is in attendance. I don't believe Andrea Perdomo Morales is here yet. And Jonna Norton.
I saw Jonna enter the Zoom call early, but I don't see her at the moment, so maybe she had connection issues. If she comes back, I'll go ahead and let you know.
Okay, thank you. I note that the following staff members are also present: David Fye.
Here.
Leslie Allen.
Here.
Cindy Dorkel.
Here.
Ashley Van Buskirk.
Here.
And I also note that Jan Arndt, Attorney General's Jan Arndt, and well, Lainey's not quite here yet, right? Or is she on the phone?
I don't believe she's on the connection. I believe she was going to attend.
I'm here.
Okay, Lainey's on the conference call.
I'm here. That's all
Great,
right.
thank you. So next, David Fye will read a message concerning this meeting being held remotely.
This is Dave Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the board about its concerns, but the Kansas Open Meeting Act, or KOMA, does not require the board to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the Executive Director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at the meeting today, as there are no individuals requested to provide public comment. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. This meeting is being conducted remotely. However, access to the meeting is being conducted by medium of interactive communication that allows members to the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of KOMA are not suspended. As such, we will be conducting this meeting pursuant to KOMA. On May 21st, 2021, we sent notice of the board's meeting to all individuals who had requested notice of the board's meeting. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other meeting materials was posted to the board's website on the day of the meeting. You may also request a copy of the agenda by sending an email to david.fye@ks.gov with the subject line "request for the agenda," and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if there are any technical issues during the meeting, you may call the board's office at 785-296-3240. A recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And I just heard an individual enter the conference call. Could you go ahead and identify yourself on the conference call?
This is Jonna Norton. I apologize, but my Zoom, I'm having audio difficulties, so I had to end up calling in.
All right, thank you, Jonna. We are now ready to call the meeting to order, and we can discuss the first item on our agenda, which is agenda approval. Any objections to the agenda as written? Hearing none. We'll move right into election of board chairperson and vice chairperson. So as stated previously, I am not seeking re-election of my position. And so we will open the floor for nominations for chair.
And I just wanted to add something. In your board packet, we did include the statutory reference for when this election would occur. Based on KSA 74-7501C, the board shall organize annually at its first meeting subsequent to June 30th and shall select from its members a chairperson and vice chairperson. And we've received a couple questions just on the mechanics of these elections. The election of these two positions is a public vote, so there's no secret ballot. And you do proceed with the chair followed by vice chair. So.
Okay, thank you. Well, I would like to nominate Leslie Seawester for chair. Leslie, do you accept that nomination?
Yes, I do.
Any other nominations to put forward? Okay. Hearing none. All those in favor of Leslie Seawester as chair, say aye.
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 Any opposed? Okay, motion carries. Congratulations, Leslie.
Thank you. I'm honored.
You're in good hands with David and Leslie.
Deb, I forgot to mention one other item too. The effective date of someone becoming the chair or vice chair would be upon adjournment of this meeting.
Darn it, I was hoping to just pass that baton just right now. All right, so I now entertain nominations for vice chair. Now, don't everybody speak up at once.
I would like to nominate Rick Steele.
Rick, are you on? Do you want to accept that nomination?
I really appreciate it, but I really can't right now. Thank you.
Okay, I would like to nominate David Anderson. David, do you accept the nomination?
Yes.
Can we nominate someone who's not on the call as well? Mary Jones?
She would not be available to accept the nomination, so no.
Okay. I mean, if we called her, so.
She's not available. I already tried to get a hold of her for this week.
I'll nominate Laura Shaughnessy.
Laura, do you accept the nomination?
I respectfully decline. Try me next year.
I'm finished nominating now. Thank you.
Any other nominations? All right. All's in favor of David Anderson as vice chair, say aye.
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 Any opposed? Motion carries. Congratulations, David.
Yeah.
Okay, moving on to minutes. Hopefully you all had a chance to look at those. Any changes to the minutes needed? Hearing none, I'd approve a motion to approve the minutes as written.
So moved.
Thank you, David.
Second it. Carolyn.
Thank you, Carolyn. All's in favor, say aye.
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 Any
Aye.
opposed? Minutes approved. All right, moving to executive director's report, David.
Thank you, Deb. In your packet of material, there's a one-page executive director's high-level review for the report. First, I want to update you on a few items from the last time that the board met. At the May 10th meeting, the board was asked to consider whether to go about enforcing the expiration of licenses which had expired during the pandemic. You may recall during that time, there was a series of executive orders during the state of emergencies that delayed the expiration of those licenses. Prior to the May 10th meeting, the governor issued a different executive order with some flexible language to allow the board and other regulatory boards to begin to enforce expiration of these licenses. And the board did direct the BSRB to begin doing that after May 28th. So we sent message to anyone who had an expired license on May 11th and gave them the 15 days notice per that executive order. And we also posted a message on May 11th on the BSRB website that for any individuals whose licenses had expired, they needed to take action, and also clarifying that after May 28th, the BSRB was returning to normal and licenses would be considered expired when they became due. So we encourage people to take action then. The state of emergency was extended one more time following the May 28th date to June 15th. Just for reference, the language on the BSRB website and what we had asked the board last time was that if the state of emergency was extended past the May 28th date, we asked for flexibility to go ahead and enforce the license even if the state of emergency was extended, which is what the board had authorized us to do. And that was covered in the language on the BSRB website and the message to the licensees. So the state of emergency did officially end altogether on May 15th. On May 14th, a lot of state agencies had all staff returning to the office full-time, and included the BSRB. We did go ahead and have the ability to do a telework policy, but it had to be one approved by the Department of Administration. So we weighed this and we looked at what could be approved and what couldn't. We decided to implement a pilot for telework through the end of December and to start it on a very limited basis and then collect data and see if it was working the way that we hoped. And if so, we would consider expanding it to other employees in the office. And so far that has been functioning very well. And we'd like to consider if it can be a helpful tool in staff retention and also making sure that we work with our staff, as I know it's been challenging for some individuals to go back to work in the office full time. Now, considering some of the other items, the BSRB YouTube channel, I wanted to give you an update on where we are with that. So that was started back in January of 2021. To date, there are 26 individual videos which have either been streamed live or uploaded to the website. Those videos include board meetings, advisory committee meetings, and have been viewed 557 times so far. The other item we've been working on in terms of an agency update is the logistics for going back to having either full in-person meetings or some sort of a hybrid, should the board or advisory committees choose to go that direction. We have been working with the equipment we have in the office. We've also reached out to the Office of Information Technology Services. They've indicated to us they really can't provide a lot of extensive assistance with that. They can connect us to services who might be able to help us with that, but those could be costly. So we're trying to check what options we have. I've spoken with a representative of Zoom to see in terms of some sort of equipment or kits they have available. And I'm continuing those conversations to see. The goal is to be able to have in-person participation as effective as people who are on the screen, so that if we use hybrid methods, the volume is appropriate. We don't have any echoes and technical issues and things like that. So we have started those conversations. We're also working with the building itself. As a state building, there are certain conditions that if individuals are vaccinated, they don't have to socially distance or wear the masks anymore. But if they're not vaccinated, they are asked to continue to social distance. So should we have a large number of people come to a meeting that are not vaccinated, we'll have to be able to work out the spacing issues. But I'm confident we can make those work. So I want to let you know that we are asking each of the advisory committees to weigh in on this. And this is also a board meeting item coming up in the agenda today. In terms of some operations updates, the passage of House Bill 2066, we discussed with the board several times. That was a bill that expedites the licensure approval and review time for certain military members, military spouses, and a certain number of other individuals. Part of that bill would include the expedited licensing timeframe. And in doing so, we asked the legislature for approval to hire a part-time position in fiscal year 2022 and going forward to assist us with these additional responsibilities. The legislature did approve the expenditure authority for us to do that in fiscal year 2022. We are currently working with the Department of Administration to identify the different roles of that position. And once we get acceptance, we can start interviewing people for that position. So I'm hoping by the next time that you meet, we should have somebody either here or far along in that process for that. What we have been working on here in the office is, in terms of all staff, they have asked us to do a performance review at the end of every year. They've also asked us to do a beginning of the year planning meeting, and then also do a series of mid-year performance review check-in meetings. And we did hold those with all staff members. And we had meetings with the assistant director and myself going through the different roles and responsibilities to allow them to ask questions, for us to give them feedback. And we went ahead and summarized those and included those as documents in the file. So we've also started something which is to track the daily functions of the staff, divided by their different responsibilities and time. I mentioned earlier this year, I'm looking to try to, there's a lot of specialization in the office, and it can be problematic in terms of people being able to take time. And so we're trying to do a review of the different roles and responsibilities of people in the office and what is taking up a certain amount of time in everyone's day, so we can look at when we bring in this new person for House Bill 2066, how to shift responsibilities, and how to make sure we have additional coverages for the office and for the staff members themselves. In terms of a budget update, I provided an additional document to you all this morning. I went ahead and broke out some of the information concerning the budget for the Behavioral Sciences Regulatory Board, and I'll explain some of this information in the table. You don't need the table, I can walk you through it, and I won't go too deep into this, but what the table includes is the balance in the Behavioral Sciences Regulatory Board fee fund. All the money for the agency goes into one fund, and just to let you know, when the agency receives revenue, there is a 10% split, and that 10% is automatically taken before it actually hits the fund. That 10% goes directly to the state general fund, and that is by statute, and that is for other certain services we receive from the state, such as administrative services and other services. So what you see in the numbers here in the table is the revenue after that 10% has been diverted. There is a column for actual fiscal year 2020, and that was what occurred last fiscal year. The state fiscal years run from July 1st through June 30th. So the balance in the fee fund at the last fiscal year was about 2.3 million. With the additional revenue and expenditures, it did decrease. That was somewhat by design. Back in 2019, the board started seeing the effects of some decreases in licensure fees, and that was expected to decrease the fee fund balance over time. And at some point, the board would need to revisit that if it continues to decrease it. So the next two columns you'll see are the legislative approved total for 2021, and then the actual FY 2021. The legislature this session did approve a revised budget estimate for this last fiscal year was just ended. That was fiscal year 2021. They also approved a request for fiscal year 2022 and 2023. This legislative approved numbers matches what we had submitted in our budget request back in September of last year, and then tracking it through the legislative session. The governor didn't make any recommendations that differed from what we had submitted, and the legislature didn't make any changes for 2021. If you look at that third column, it says actual FY 2021. That column reflects what we just received based on the numbers in the smart accounting system. And you may look at the beginning balance and wonder why those two numbers are not the same in terms of the beginning balance for the legislative approved 2021 and the actual FY 2021. And part of that has to do with some items we've been taking care of recently, and those are called encumbrances. And encumbrances, not to get too deep into the weeds, but encumbrances essentially you want to spend 2021 money for 2021 expenditures. So you think you will be having a bill due, but you're not sure what that bill will be. So you set money to the side to pay for those expenditures. And if you don't spend that money, it stays in the fund. And so we released a number of old encumbrances. And so the actual beginning balance in FY 2021 was a little bit higher than what it was in the legislative approved. The revenue for FY 2021 compared to what was previously estimated was higher than what was estimated when the budget was submitted in the fall by about $40,000. So revenue was up in terms of FY 2021. Looking at the month to month, we were behind prior to the end of the year. So I think the big push when those licenses were considered expired and people needed to renew, that did have a big effect on revenue. So we did come in ahead of where we had previously estimated, which was good. In terms of expenditures, we were lower by about $100,000 what we had previously estimated. Some of that is because there is a little bit of money in the budget for part-time staffing if necessary. There's also some funding for expert witnesses, or should we have cases go to the hearing level, some of those that might require an additional legal expert or additional medical expert can be fairly costly. And so that money is in the budget if needed, and if it's not, it just stays in the fund. So overall, we spent less than what we had previously expected, and the revenue came in a little bit above. The fee fund balance is going down. If you look at the actual number for the fee fund ending balance in 2020 compared to 2021. So it did go down, just not as much as expected. The numbers for FY 2022 and FY 2023, I won't spend a great deal of time on, but you can see there for comparison. Those will be adjusted once we submit a budget in the fall based on the new ending balance for FY 2021. And just to let you know, those actual FY 2021 numbers might change because of what I previously mentioned in terms of the encumbrances. So that is what we know of today, but that number might change in the future. So.
Andres. Excuse me.
And Andrea just entered the waiting room, so I'll let her into the meeting. But I wanted to go ahead and update you on the revenues, expenditures, and ending balance for the Behavioral Sciences Fee Fund. So feel free to ask me any questions if you have any questions on the budgetary issues. Another item I wanted to make you aware of. So in between when the board met last time and this meeting, I just kind of wanted to reflect some of the work of the office in terms of the advisory committees and also the other committees that are being facilitated. So you know sort of how the breakdown works between the spacings of different committees. So you can see a reflection there. We did start splitting out those application reviews that need to be reviewed in a confidential CAPA session or those under the Kansas Administrative Procedures Act. So we wanted to go ahead and show you some of the different committee meetings and advisory committee meetings that are being facilitated. Additionally, meetings to be attended or meetings attended. I did attend a ASWB Social Work Compact kickoff meeting that is also through the Council of State Governments. That kickoff meeting for that compact was very basic. Some of the meeting focused on what is an actual multi-state compact and things like that. But there is a partnership with the Department of Defense. And they indicated that one of the reasons they picked social work for this compact is due to the number of individuals licensed in that profession. So I will continue to monitor that and I'll provide updates as that group continues to meet in terms of the compact. There's also a entity which will be talked about a little bit more in the agenda coming up. That is the Overdose Fatality Review Board. There was an introductory meeting last week and I attended that meeting. And then coming up in August, I'll be attending the National Board for Certified Counselors Conference in Denver, Colorado. So I hope to learn more about some of the items going on at the national level for that profession. So with that, I'll stop and see if there's any questions.
Okay, thank you, David. Next item, staff reports.
So there is a document in the board packet that shows the license numbers for all professions and then the totals for each profession. Sorry, license totals for each license type. And then for the professions, there's the totals. We have gone up a little bit and we've just, expired all of the people from COVID. We were at 13,000 something, and now we're at 14,129. I've been looking at older numbers. I tried to get information from the old database to compare, but I can't go back that far because it doesn't hold the history. But now as we move forward, we'll be able to pull exactly how many licensees there were on any given day. So you'll have a little bit more history with the numbers.
Very good. Thank you for providing that. Any other staff reports? Okay, moving on to new business. So in your board packet is a resignation letter from Danielle Johnson, who represents the public due to taking a new position that will preclude her from attending the meetings. So I understand, David, you've been working with Department of Administration on that vacancy and the fact that we need someone else to take her place.
Yes, and Deb, actually that goes through the Governor's Office of Appointments, but we did reach out
Oh,
to
I
them.
said Department of Administration, didn't I? My bad.
Right, yes, we did reach out to the Office of Appointments and provide the letter to them, and they indicated that they are examining individuals and hope to have that decision here in the next few weeks.
Okay. Well, we will miss Danielle. I'm assuming we'll get her a certificate of appreciation for her service. Thank you. Assistant Attorney Jan Arndt is retiring. Jan, you want to tell us about that?
Well, there's not too much to talk about, just my time has come.
How long have you been with the state in that role?
Well, I've been with the AG's office since 2007, but I've been in other agencies over the years, so it's been over 26 years of service altogether.
Well, thank you for your service. Thank you for your time with the board.
It's been a pleasure. Enjoyed working with all the staff and all the board members. So Lainey, I think, is going to be probably the one who's going to be taken over. So I wish all of you well, and I'm sure she will do a competent job for you. So I'm sorry to go. It's kind of bittersweet, but it's ready.
Are you retiring, or are you just going to something new?
Right now, I'm just retiring. Just take time off for a while, and then if everything is safe, maybe do a little bit of traveling.
I think you're probably good to go. Awesome. All
And-
right.
Congratulations, Jan.
Thank you.
Yeah,
All
congratulations.
aspire to retire someday.
Yeah, and on
That's the
behalf,
goal.
yeah, on behalf of the agency, I wanted to thank you too, Jan. You know, with me coming on board back at the end of last year, you've been a big help to me, and I really appreciate it. But I know we reach out to you and have for a lot of different questions and different items, and so appreciate your availability and all of your guidance. And so thank you for your help.
You're welcome.
Well, Lainey, I can't see your face, but welcome to the board. I'm just really appreciative of the transition time with Lainey participating in things. It feels like that's a luxury anymore to have someone new kind of shadowing and helping and training. So that's good.
Yeah, I've learned, it's Lainey, I've learned a lot from Jan, not only with you all, but with the other boards that I've watched her work. So she's definitely a good foundation. And I think, 6 months or so I've been shadowing her. So I have a good idea of the amount of work that you all do. So yes, I look forward to it.
Are you trying to say we're high maintenance?
Yeah, I can't say those exact words, but yes.
Yes, indeed.
All right. Okay, well, the next item is the review of regulatory language related to the passage of our bill, which can I get a woot woot on that we got what we wanted this year in session, you know, for the most part. So we need to talk about some regulations to make these operational.
The definition regulation is not the right one, so I'm gonna have to look for that. I'll start with a different regulation. And well, there's social work, 102-2-12 licensed specialist clinical social work licensure requirements is the first regulation I'll go over.
So Leslie, you said that was 102-2-12.
Mm-hmm. Guys, let me know when you're ready.
I think you can go on, Leslie.
Okay. So on page 2, down under little b, lowercase b, number 2, we're changing the practicum just to satisfactory completion of a graduate level supervised clinical practicum, and the language about the professional experience, including psychotherapy and assessment, remains the same. However, the and shall include not less than 350 hours of direct client contact is being stricken. And then all the requirements after that, because it gave an opportunity for them to do the post-grad hours if they didn't have them in the practicum. That's all for that section. And then on page 4 of 6, we get into the 3,000 hours, 1,500 direct client contact. And I apologize, I have streaks on mine, it's hard to read. There's some different changes for social work because they had different requirements to begin with. They had the requirement of 1,500 hours providing clinical social work practice services that were not face-to-face. That's being struck. So it's just changing it to 100 hours of clinical supervision. 100 out of the 150 must be individual. Up to 50 may be in group. And all shall be conducted face-to-face, either in person or if confidentiality is technologically protected by synchronous video conferencing. I don't know if that's how you properly say that, but I know you guys have talked about synchronous. So I put it in there. It'll get corrected if I worded it wrong. We struck the part where they were supposed to send in written verification of how they were protecting that, because we don't have any knowledge of that. We don't really have enough information to approve or not approve that. And then I think that's it. And theirs used to be a maximum of 2 hours of supervision shall be counted for every 20 hours. And now it is going to be 1 to 15 like the others. Thanks. So theirs will be one, there, it's at the front, very beginning, at least 1 continuous hour of supervision for each 15 hours of direct client contact to total 100 hours of clinical supervision. So that's the social work regulation. And the reason that I'm bringing you the regulations, I guess I should have started with this, is that they're to the point now where I need you to vote to move them forward so I can start the process by sending them to Mary or the budget. Division of the budget. I did not change every regulation because it is a lot of changes. And when I change them and I have to change them back and you get into underline and strike through, it can get very confusing. So I was hoping that we could use, so all of the post-grad supervision regulations could be approved to move forward because they would have identical language. And then so I will go through, this is 102-212 for social work. And so I would need to know if you are, if you will approve that to move forward. And then I'll go through the counselors or MFTs because your language is different than social work.
Leslie, this is Jan. I have a question. Will you be running temporaries and permanent both? Because
I don't know if
permanents could take about 6 months or so. So you're going to, if you need something in place because this is already effective, you probably need to do temporary and regs at the same time.
Okay. So Jan, if the board votes and approves for all of these to move forward, do the temps come back to the board before they go to that committee for approval? Or do they just come back at the end after the open public comment period?
I've seen it done both ways.
Okay.
If they've already adopted it, then with the for the temporary regs, the rule and regulation board, once they approve it, then it's ready to go. You wouldn't have to schedule a special meeting.
Okay.
So let me understand what we're doing here. So you have actually edited the 102-2-12 exactly as we are presuming it would go.
Right.
Barring any edits from Department of Administration, right?
Right.
So it seems like we could do a formal motion to approve those if the board's ready to do that, and then direct you to proceed in kind with the others.
Yes.
And work to bring those back whenever is appropriate.
Right. And I have, I don't know if you want to do them individually, like social and then the others, or if you want me to do them all and then you can vote, whichever you prefer.
This wouldn't be a motion to adopt them because they're not approved. This is just the motion to go forward with the process of sending them to the Department of Budget and Department of Administration to Attorney General's office. And each of those agencies put a stamp on the regulation. And so once you have all 3 stamps on the regulations, then they come back for adoption by the board. So you may have to have a special meeting for the temporary, to do those you wouldn't be able to adopt the permanent ones because the procedure has not finished. You still have to have a public hearing and all that, but you would have to have that for the temporary ones. And if
Okay.
when you adopt the temporary ones, then you do each regulation one by one. Because there has to be a roll call vote when you adopt the regulations.
Okay. So any discussion about the edits that she has made to coincide with the bill that was passed for the social work profession, knowing that this is the type of changes we'll make where it's needed on every profession to match the bill? Any discussion, questions, comments? Okay, so hearing none, I would presume then that we have consensus to direct staff to continue the process.
Okay, thank you. The next one is 102-5-7A, and it is for post-grad supervised experience for clinical marriage and family therapists. And it's similar, except yours is just set up different. So I thought I would go through one because marriage and family therapy professional counselor, master's level psychology and addiction counseling are laid out more the same, and social work is kind of an outlier. So on the first page, it talks about the 3,000 hours, 1,500 client contact, and in order to allow telephone supervision, which is in a different regulation for social work. Absent extenuating circumstances approved by the board, clinical supervision shall be conducted face-to-face, either in person or if confidentiality is technologically protected through synchronous video conferencing throughout the entirety of the postgrad supervised professional experience as follows, as specified below. At least 50 hours of individual clinical supervision occurring with the supervisor and the supervisee, up to 50 hours of clinical supervision with one supervisor and no more than 6 supervisees, at least 1 hour session or 2 half-hour sessions of clinical supervision for each 15 hours, of direct client contact, and at least 2 separate clinical supervision sessions per month, at least one of which shall be individual supervision. Telephonic clinical supervision may be allowed under extenuating circumstances approved by the board. And then you get the formatting got all messed up. And then of that, when someone is a doctor, they only, if in a related field, they only have to do half of the supervision requirements. So on page 2, it talks about up to 25 hours can be grouped. At least, there's a mistake, 25 hours must be individual. And they still have to have 2 separate supervision sessions per month for 3,000 hours, 1,500 direct client contact, and then they would only have to do half the hours. So 2,000 hours, 750 of those would be direct client contact. That's really all there is for that one. Any questions?
Has Mary Jones seen this?
I just used her reg. It's the same as, it's almost identical. There are some small differences in how it starts for each profession, but I was just using hers as an example.
Oh, I see. Okay. All right. Any questions for Leslie on this particular regulation changes?
So LMLP, LPC, and ACE and addiction counseling would all, and master's level psychology would all be very similar to this. So I want to be able to move forward with all 4 of those professions with this sample language. Well,
Kind of.
kind of, it's the right language for that profession, and it'll be put into each of the other regulations.
Any objections to Leslie proceeding? Okay, next item.
Okay, so this one I used professional counseling. It's 102-3-3A, education requirements. And this is regarding the practicum that we're changing and adding a related field. Because that had not been added to the education regulation as an option to become an LPC. On page, I didn't number this one. On page 6, and I apologize, this one isn't numbered. It starts with number 3. Completion of one of the following experience requirements. Satisfactory completion of a graduate level supervised clinical practicum of professional experience that includes psychotherapy and assessment. The practicum shall integrate diagnosis and treatment of mental disorders with the use of the Diagnostic and Statistical Manual of Mental Disorders as identified in 102-3-15, and shall include not less than 280 hours of direct client contact or additional direct client contact hours providing psychotherapy and assessment as part of the postgraduate supervised experience. The experience shall consist of a number of hours that the applicant was lacking to attain 280 hours of direct client contact during the practicum. The postgraduate hours and the practicum hours completed shall total at least 280 hours. This experience shall be in addition to the 3,000 hours of postgraduate supervised experience required for each licensed clinical professional counselor as required in KAR 102-3-7A, which is the supervision regulation. That's the, excuse me. That's the language that's being put in about the making up the hours, and that will be put in the other professions regulations as well, except for social work, which doesn't have a requirement anymore. And it doesn't go into addiction counseling either. Do you have any questions on that one?
Is there a definition for a related field?
That's going to be in the definition regulation, which is not the right one that's in the file. So I have to go look for it. But I figured I'd let you guys go move on to your other things, and I would look for that regulation and then email it to you all. Maybe we can do it before the board meeting's over, if that would be acceptable.
Works for me.
Okay, I do have one more regulation then for psychology. Yeah. So 102-1-5A is supervised experience and supervisor qualifications. This is the psychology regulation that defines how pre and post-doc supervision shall be done. And they had requested a change be made to allow more, or to allow televideo supervision. So page 3, starting at the very top of the page is a capital A. provide individual face-to-face supervision by meeting in person or if confidentiality is technologically protected by televideo with the supervisee. The means and the televideo and synchronous will be added if they feel that's proper. The means of supervision must have the ability to include discussion, observation, and review of documentation. When meeting face-to-face is not practical due to extenuating circumstances, telephonic supervision may be approved by the board.
This is one from Licensed Psychology Advisory.
Yes.
So I just wanted to clarify, this was not something included in House Bill 2208. However, the Licensed Psychology Advisory Committee, their statutes were a little bit different than some of the other professions. So when we brought forward 2208, we talked about statutory changes to allow the supervision by televideo. Well, their statutes really didn't cover that. That limitation that no more than 1 out of every 4 would be televideo, that was in the regulations. So it required a different process. So we couldn't make that change to the statutes. It had to be something that would be going forward to the regulations. So the Licensed Psychology Advisory Committee did discuss that. They voted to go ahead and recommend a change for the full board's consideration to go ahead and change that so that it could be uniform with the other professions to that all supervision could be done by televideo. So this one's a little bit different. The other regulation language you've heard is kind of matched up with what was in 2208, trying to make those things sync. This is sort of a little bit different in that it was a recommendation by the advisory committee, but it does seem to be in the same spirit as the other changes that were made in 2208. It's just the process had to be a little bit different based on what was included in statute versus regulation for this profession. So on this one, it might be helpful to have an actual vote just to confirm it since it wasn't part of the 2208 process.
And therefore would not be a temporary regulation, I don't believe. Unless, Jan, can they do a temporary regulation because people are needing it right away?
Well, for temporary regulations, there has to be public safety. And I think like for the others where you've had a statutory change, you have that because until you get your regulations changed, you don't want to delay licensing. You want to get people licensed to help the public.
Okay.
I'm not so sure about this one. I mean, you could try a temporary regulation, but I'm not so sure how much, if it would go through or not. I mean, if the pandemic was going on, I think you might, but it's been canceled. So I don't know about that. You can always try it. I mean, they're going to, if they don't agree with you, they'll just say no. They're not going to approve it. The one question I did have, when you're talking about face-to-face is not practical due to an extenuating circumstance, I think you've talked about defining extenuating circumstances that they can use telephonic supervision.
Right.
But I'm questioning, you said telephonic supervision may be approved by the board. So is that to prove that it's an extenuating circumstance or a telephonic supervision, and that would have to come before the full board?
That it would be an extenuating circumstance, reason that they could use it.
Okay, so they're coming to the board to say that there's extenuating circumstance. So it would be like the pandemic. If you've just had your board and the emergency declaration gets declared, then they've got to either have a special meeting or wait till their next regular scheduled meeting to approve the extenuating circumstance.
Extenuating circumstances currently for applications and temporary licenses have been delegated to the executive director. So I would hope that that would be the case with this as well, because it would cause a lot of lag time for them to be able to move forward.
Well, and the board did discuss this at the last board meeting too. And the board did talk about that the decision of extenuating circumstances could be done by the executive director. So that was talked at the May meeting.
So you'll do a formal motion then for that.
I thought we already had it in place, so I'm not really clear on where that's, formalized.
Yeah, I think
we're just borrowing from what we've already been doing, Jan. It's just a bigger scope of
Okay.
That's the reason.
And I can remember we talked about, the extenuating circumstances with that part. As I said, I'm getting ready to retire. So, it just went over my head.
So
Not everything
I-
sticks there anymore.
when we were talking about the temporary regulation, how this would affect licensees to provide services to the public is coming out of COVID, they had to use televideo supervision because they could not meet in person. And we can't license anyone because currently their regulation says only 1 in 4 can be
Right.
televideo. So that could be added as a reason, right? To request a temporary reg?
I mean, you could try it.
Okay,
We can, I can discuss that with David later.
okey doke. So that was it. It was because they only had the ability to do 1 supervision by televideo or telephone in every 4. So it removes that and they'll be in line with everyone else now.
And just to weigh in, there was all kinds of confusion about whether that was literally 1 out of 4 or if it was just 25%. And so there were people lighting things on fire. I mean, there was a lot of confusion. So
Any
It seems-
questions? Oh,
It just seems to me that bringing this one along with the rest makes a lot of sense. To see if we can get a temporary.
Yeah.
Good work, though, from that committee. I'm glad to see this move forward. All right.
So now-
Go ahead.
Sorry, Deb, since this was not something that was included in House Bill 2208, you want to just maybe recognize that it's a consensus of the board to go ahead and adopt this as a recommendation or take a vote. Either one's fine with me. I want to get on record. So
Yeah. Any objections to moving this forward? Okay, hearing none, we have consensus.
and then I will, I'm gonna look for the definition regulation because I had it done. However, it's not in this file on my computer, so I'm gonna have to see where I saved that. And then I will email it to everyone, and then if somewhere in between or at the end of the meeting, we could go over that, I would appreciate it.
and that was 102-3-1A, correct?
Yes.
And we'll go ahead and post it on the board's website after it's been received as well. So.
Trying to keep up with where we are now. Okay, so I think we're at setting amount of one-time fee item.
Yes, and I can go through that. So there's a document in your board packet. It's a 1-page document. It's basically out. It has 2 different sections to it. It says setting one-time fee and regulations for the board-approved clinical supervisor for professional counseling. And then halfway down the page, it says setting one-time fee and regulation for board-approved clinical supervisor for marriage and family therapy. So previously in statute, it did say that postgraduate clinical supervision of professional counselors on or after July 1st of 2017, all licensees providing postgraduate clinical supervision for those working towards clinical license must be a board-approved clinical supervisor. And then it said applications for board-approved clinical supervisors shall be made to the board on a form and manner prescribed by the board. Each application shall be accompanied by the fee fixed under KSA 65-5808. Well, the issue was that fee had never been set in statute, but the language was in statute for several years talking about that a fee could be set. This year, as one of the items in 2208, we did go ahead and set a fee cap so that this kind of closed the loop for those 2 professions for the board-approved clinical supervisors. So what you see there is then a modification to 65-5808. The board may fix the following fees, and any fees shall be established by rules and regulations adopted by the board. And then we included the new language there for application as a board-approved clinical supervisor, not more than $50. And in the previous board's discussion on this item, essentially that sets the fee cap, so it can't exceed that amount. And then in regulation, what you could do is to vote to have the fee be any amount within that cap. What was discussed previously was maybe half of that amount, $25. But this is a one-time fee. If you were to make it higher than that or lower than that, I don't think there would be a significant impact on revenue for the agency. So I just kind of wanted to let you know, but yes, that is a one-time fee. And so for people who are already board-approved supervisors, they would not be submitting this form because they're already considered board-approved supervisors. So it would just be new individuals seeking to become board-approved supervisors after the date that is the amount that's put in place after the regulations have completely been finalized. So hopefully that clarifies the impact of what this amount would do. But essentially what we'll be looking for from the board is to discuss and then determine if you want to set an amount within that $50 cap for both of those two professions.
Any thoughts from the board about a fee? I'd like to keep it fairly low.
This is Leslie. Jan has said in the past, we can go as low as $5 or $10. And there's not a very large amount of applications, less than 20 a month. And most
In other words, it doesn't set a minimum, but it does set a maximum.
right. No, I'm saying in the past when we've talked about doing that work for other things, then, you know.
Yeah, wanting to go to zero when the
Right.
when the law said otherwise.
Right.
This is Carol, and I support the 25 as we had originally discussed. I think that's very reasonable for a one-time fee.
I think it's okay to cap it at 50 and then it meets, you know, the lower fees like you all are discussing too. That's just kind of what I was looking at.
Well, and I should clarify. So what the bill did is it set the cap in statute. So the cap right now is $50. And then what we'd be looking for right now would be something to put into the regulations, which could be within that $50, some number there. And so if the board ever wanted to go and change that amount, they could make a modification to the regulation without having to pass it in a bill before the legislature. So we've already had the cap set from 2208, and we're just looking for the amount within that to go ahead and set it in regulation right now.
This is Rick. So I'm hearing someone had put in there, I think Carolyn said, or someone said $25. Is there an actual administrative cost that we need to cover? You understand what I'm asking?
Yeah. So when individuals apply to be a board approved supervisor, there is a form that's filled out and those are reviewed. And so there's an administrative cost that kind of correspond to the fee. So I think that's the idea behind it, but it's not something that would come up every year. It's just a one-time process to get them approved.
Right.
So something small to cover that administrative cost on the agency is kind of what we're seeking as the reason why there's a fee attached to this.
Right.
And so,
do you have an estimate on the actual dollar cost? So it takes some number of people, some amount of time. Is there a way to estimate per application, you know, how many person hours that, I'm thinking at 10 versus 25, it would be nice to have a conceptual reason rather than just pulling a number out of the air.
Sure. I think probably about $15 probably would be about, if you're trying to just look at staff time.
Yeah.
There's a number of other costs to the agency that just get factored in, in terms of overhead and things like that. But if you're looking at just direct staff time, probably about $15 would be fair. $25 could be reasonable too if you factor in other costs too, but somewhere in that range I think would be reasonable.
Although it's a one-time fee, is there a requirement that they reapply for that status?
So you have to, when you renew your license, you're supposed to complete continuing education. But on the renewal, the form is going to ask you if you're approved supervisor, have you done these CEUs, kind of like it does for ethics? And then if you do, then it's automatically renewed. You don't have to do anything special.
And doesn't require any additional staff time.
No.
Thank you.
So one could conceptually argue that a 15, 'cause I'm thinking about just accountability to the public and not wanting, like Deb mentioned, not wanting this to go high just because it could. But someone could say that we are doing, if we did 15 or 20, we could say that that's based on the actual cost of processing that application.
Yes.
And that
Yeah.
we wouldn't be making excessive money, right? And that we would be
I would
covering. So
Yeah, I think based on the number of individuals who apply to be a board crew supervisor and looking at that range of the amount, this is really not a revenue generator. It's just more to try to be fair in terms of staff time and other responsibilities that are part of this process. We're already doing these types of reviews. We've just been doing them without the fee being received, but this would tie to the actual staff time that does go towards it.
Laura Shaughnessy, do you want to weigh in since this is one of your professions?
No, I'm just listening and it all sounds reasonable. I like the idea of keeping it low, keeping the cost low. We don't want anything to be prohibitive. I think it sounds great.
does 15 or 20 sound more reasonable to you, given the staff time that's required?
Yeah, 20 seems like a reasonable amount to me. 15 seems a little low. I think all the time about how much we put on our staff. And so a little more revenue. 20 still seems low enough to me.
Carolyn, could you live with 20?
Yes. I was, when I said the 25s, I was thinking of our staff time too and how busy they are. So, but yeah, 20 would be fine.
Would someone like to make a motion?
I'll make the motion if you tell me what it needs to be.
Make a motion that we would set the fee at $20.
Okay. I make a motion that we would set the fee at $20 for application for supervision. Okay,
I second. This is Leslie.
thank you.
Just to clarify, if this would be for both of the professions, professional counseling and marriage and family therapy.
Yes.
Thank you.
Any other discussion? All in favor, say aye.
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 Hi.
Any opposed? Motion carries. Good discussion. Next item is yours, I think, David, about the Overdose Fatality Review Board.
Yes, so the Department of Health and Environment, KDHE, received a grant from the CDC essentially to look at fatalities from overdoses and to study the circumstances surrounding these fatalities with the ultimate goal of reducing fatalities through overdoses. And so with that in mind, they sent a letter to a number of different agencies and other entities seeking to see if individuals would want to participate in this process and forming an overdose fatality review board. And one of the entities they reached out to was the BSRB. So there was a meeting that was last week, and I attended that meeting on behalf of the board. Essentially, what it sounds like is that this will be a body, and we did break out into a small group at that meeting. Most of the individuals that were on the small group with myself were medical professionals, and they compared this to other groups that look at fatality-related maybe committees at hospitals that examine the situation surrounding a death and then make a recommendation or report back to the hospital. I think that's the ultimate goal in mind, is to study these fatalities and look for information that could be helpful in terms of preventing these type of situations in the future. There was a bill that was before the legislature this last year that I think also involves some other topics like K-Trax, and that bill didn't pass. But since they had the grant, they went ahead and started to have this committee meet anyway, because it didn't really require legislative approval. So my background is really not in the health professions. but they've only had one introductory meeting and they were still focusing on what exactly their role would be. They are planning to meet again in about a month. And so I could go ahead and collect information on attending future meetings and report back to the board. Right now it's such an introductory stage of this committee that if there was an individual on the board who wanted to serve as a representative for this group, I would be happy to give up my position or be there with that person. Right now, since there's not a lot of information about this group, I'd be happy to attend for now and then report back to the board for the board's consideration of maybe naming someone in the future. Either way is fine with me, but I have limited information right now. I expect to receive more, and when they have more outlined their process, I could report back. They also mentioned at some point they would like to get more legislative accompaniment with this process. And so I imagine there will probably be a bill in the future, maybe for the next legislative session, but right now they're just meeting and discussing doing this research and then coming up with some recommendations maybe for the future, maybe for the legislature.
Okay, thank you. Any discussion, questions for David about this overdose review board?
Well, I have some interest in that. I did this kind of psychological autopsy work when I was with the Department of Corrections, and they had, most of those were suicide deaths, not necessarily overdose, but overdose was always a part of that. So I have some interest in that, depending on how things work out.
Thank you, Bruce. So how do you want to proceed then? I'm assuming no one else is clamoring for the. Do you want David to continue to attend and find out more about, because that was some of my questions just in general, is frequency, just kind of, is it in person? Is it virtual? It's hard to commit to something when you don't know some of the details. Do you want him to continue to attend until we get those, and then you can make a decision?
That sounds good. And then if he comes back with some information, we can always blame him in the future that it didn't work out right.
Sounds good. I'm sure he'd love to take that responsibility.
But that was part of my kind of morbid duties at the Department of Corrections, is to jump into those kind of cases.
Fantastic. I appreciate your willingness. And so we'll put you on notice and we'll go from there. How's that? Thank you. Next is the Kansas Fights Addiction Grant Review Board discussion.
Okay. And this, I went ahead and included a document in your packet for the meeting. So I grabbed some information from House Bill 2079. This was a bill that passed during the 2021 legislative session. The bill authorizes the Kansas Fights Addiction Act, and it creates the Kansas Fights Addiction Grant Review Board and outlines what entities would have a member. So this group is a little bit more formalized. They did go ahead and look to us to have an individual to assist with this process. But essentially, the Kansas Fights Addiction Grant Review, Kansas Fights Addiction Fund would be under the Attorney General's office. And essentially, there would be money that would be remitted that the state receives pursuant to opioid litigation. And then a certain amount would go to this fund, and then another quarter of it would go to a municipal fund that is very similar. And individuals pursuing substance abuse programming could apply to the Kansas Fights Addiction Grant Review Board for funding, and essentially trying to obtain funding for programs going forward. This group, I don't believe, has met yet. There have been entities who have started to appoint individuals, but this is another group that has just started or is starting, and I don't have a lot of details about this one. I will be in contact with the Attorney General's office to try to get more information on the frequency that they'll be meeting, the responsibilities they're looking for from our office. But for the time being, if you would like me to go ahead and represent the board while I seek this information, I'd be happy to do so, and then report back to you when this group has a little bit more formalization and we know a little bit more about what would be expected from our members to participate, if that would be your preference.
One of the things that David and I talked about, and I'm hoping that we can get some clarity, is let's say if a board member says, oh, I'll, attend this, and that board member also works for an agency that performs alcohol and drug services, would that in any way preclude their agency from applying for and receiving those funds? So until that's clarified, I think that makes it very challenging to know, at least from that perspective. Obviously, if you're interested and you don't have those concerns, then you're welcome to speak up. But otherwise, it seemed more prudent to get information before that appointment is made. Questions or comments? All right, David, so you could continue to update us about that and let us know.
Okay, sounds good.
Next item is setting like whether we're going to meet in person, remote, or hybrid for our board meetings. So once upon a time, it was a general idea that we meet in person every time we met. I know that's very foreign to some folks. I know it feels very foreign to me right now, and I did it for years. So there's different ways that we can proceed with this. I will say that I think whatever we need to do, we need to set it as the expectation, for example, in person. So if we're going to meet in person, that's the expectation. If you just can't or whatever, then that's fine. You can call in or whatever. I think to have one or two people on some sort of Zoom or whatever or phone is fine. It's not ideal. I promise you, you won't really enjoy it that much. But it's difficult for the chair as well. So that's my only caveat, I guess, as we decide or at least discuss what we want to do. The other thing that I thought about was, since we've grown so comfortable with this medium, perhaps we could plan on, if this is even what you want to do, I don't care, the winter months meeting this way. So it just takes the weather out of the equation, no stress, no worry. Plan to try to get together in the summer months to see each other, to have that kind of relationship building, etc. So just some random thoughts. We meet 6 times a year. You could do 4 and 2, 3 and 3, or go back to the way it was. I'm good with that too.
Well, this is Bruce. My considerations are, I know almost all of us travel to come to these meetings. For me personally, it's 2.5 hours there and then 2.5 hours back home, 5 hours in a day. And if the meeting lasts 4 or 5 hours, that adds up to a very, very long day. So there's that consideration. The other consideration is that, I don't know, sometimes it feels good to meet with other people, and kind of drink coffee together and all this and that. So I think there's something to be said about that too.
I support the idea of getting back together face to face. I think it does a couple of things. One, does create a opportunity for people to get to know each other and to do some kind of networking before and after meetings. I also appreciate the issue around travel, but I also think it lends to an environment where there's a little more discussion of items. So I would support a return to face-to-face.
Are you presuming full-time then, David?
Yes, or at least the vast majority.
I mean, we know about a weather incident or whatever, then we can always decide to meet, by Zoom, right? Forecast, instead of canceling or whatever, which we might have done in the past, we can just meet this way. Other thoughts?
If we meet face to face, if someone says something and you roll your eyes, does that get entered into the minutes?
No, that's best captured on Zoom, actually, Bruce.
I keep my eyes pretty hidden.
One thing we are planning to do is to continue to stream meetings. And so if we do have in-person meetings, we are looking at getting multiple cameras so we can get different sides of the boardroom to make sure everybody's still being broadcast. So.
How exciting is that?
Deb, you may have already mentioned this, but what were the results of the survey, informal survey
Thank you.
that David sent out to ask the board what their thoughts were?
So I believe there were about a third that wanted to go back to having in-person meetings, a third that preferred to do remote, and then a third that said that they were flexible based on what other members of the board would prefer. I know some individuals who indicated that they were flexible said it could be nice to continue to do some remotely, but that it would also be nice to be in person for some too. So it was kind of split just across the board members.
I would be in favor of doing a split.
I agree. I have to say that just traveling from Topeka, it's really not a problem to me. But for those people that travel who work full time, it's, that time is very valuable when it comes to someone who's employed or someone. It's difficult just to put out that extra time if you don't have to. But having said that, driving to Topeka, that's not a problem. But I've gotten quite used to the Zoom, and it's. I was going to ask Deb, since she has chaired both in person and Zoom, if one is easier than the other, or if you notice any difference, because you commented that, something about.
There, it's just different. I mean, it's just different, right? So I don't know that the Zoom took some getting used to, right? Facilitated meetings for decades in person. So it was an adjustment to do nothing but remote. But, once you kind of get the hang of it, there's some benefits to that as well. It's kind of nice to see everyone's faces, all at once. And I don't know, it's just kind of different. It's easier to mess with the documents in some ways because you're already looking at your computer. But I think there's a real value in meeting face to face.
This is Jan. I was going to say, even before that, because we have so many new board members, and I know David is all new, that started, when I say new, started pandemic or afterwards. Even before the pandemic, it was not a 100% in-person attendance. For a few years before that, once people became more technological, competent or aware or whatever, there were a few board members who were attending by some type of video conferencing. So say if anyone, was not able to do that travel or their schedules didn't allow it, I mean, there was always one or two board members who were using some type of electronic means to attend. So, when you say in person, I'm assuming you mean that not 100% would be what you anticipate.
Right, it's just more of setting the expectation.
Yeah.
I didn't really want to go forward with a hybrid, like come if you want, don't come if you want kind of thing. Because
you're going to open it up to the office for people to attend, but it's not necessarily mandatory, I think is what we're saying.
I'm using the term expectation.
Yes.
Expected that you attend in person unless you just can't, if we decide on in-person meetings.
Deb, is that the idea there being, it would be unfortunate if we have an in-person meeting and there's two of us sitting in a room and the rest of us on Zoom.
Right. Or half and half, or even, because then it's more difficult, I think, for the chair.
Well, I am on another board that meets also 6 times a year in person. And then the other time we were already doing a conference call. We just recently made a decision to do half and half kind of. So we're continuing that model. Again, the expectation that you're present, and then we have the other ones. Zoom is planned out that way. So
Yeah.
I just think that for us has worked. Again, I'm in Topeka, so it's not, that's why I was one that could go either way, because I don't have to do that drive. But I respect those of you that do have to do that. And I think winter months make the most sense for us to do the remote version. So yeah, I'm open to that.
Before the pandemic, I know I attended a couple times by the video link, and our technology has really improved since then, because the audio quality was horrible, echoes and cut out and all this and that. And the video, you looked at the ceiling tiles for the whole meeting. So, I mean, if anyone wants to do Zoom now, I think that's a lot better, just to keep that in the back of your mind.
This is Carolyn. If we decided to do half and half, because would it make sense to do 6 months during the winter months or 6 during the spring, summer? I mean, I think it would be important to, have some kind of description or some definition of what months we'd be meeting, or every other month, whatever, but there should be some way to schedule that or know that.
Right. So one option would be every other, alternating. Or you could do, so we only meet 6 times, so it could be 4 meetings in person and 2, just scheduled remote. So it'd probably be January and maybe November, or January and March, or I don't care, I'm not, whatever we think, March or November, which is the crazier time with the weather or other considerations. So every other, or winter, summer, if you will.
I like the 4 and 2, and picking the 2 to be your maybe November, January.
Kind of around the holiday kind of thing. Kind of agree. I don't think there's any question. January always sneaks up on me when we have these board meetings right after the holidays. So that definitely would be a nice one to do remotely, I think.
I was waiting to hear from Laura before I spoke, because I just kind of wanted to hear everyone else's opinion. So I see her microphone doing like mine, turning on and off, waiting my turn. Go ahead. Do you mind, Laura, giving what your thoughts are, and then I'll maybe follow that?
Sure. Thank you. Well, first of all, I look forward to meeting all of you in person. I have not met any of you, so I'm excited about that. I like the idea of taking the winter months off, but really being able to meet in person as much as possible. I think it creates a different atmosphere that we all, I think, hopefully can benefit from.
And I will follow that up with, I agree. I think I haven't disagreed with anyone, what your thoughts are on any of the meetings. I'm open to whatever you choose to do. I'm a very personable person, so I like to meet in person. I like to see people, and I'm a huge networker, so I love to get to know people. And I have mentioned several times to Deb, and I think even David, that it's really hard to kind of get to know people when you're on a Zoom call. So I look forward to getting to know you all on a different level as well. So again, I'm open to the 4 and 2 or the different times, but I am looking forward to the in-person if everyone is okay with doing that at least some of the time. So adding to the agreement, I think, what I did. So.
Well, just kind of based on the discussion, it sounds like the consensus is that we meet in person. Would that be March, May, July, and September? And remotely, November and January. I think the nice thing about this, because we've had a lot of, in the last year, hopefully it'll slow down a little bit, we've had a lot of kind of emergency board meetings. And so we've gotten really accustomed to being able to be nimble in that way remotely. So I think we can continue to plan on that. I mean, trying to plan an in-person on a last minute basis is pretty impossible. And I do prefer this medium over phone. I remember in the, several years ago, we did emergency board meetings by phone, and it's just challenging because you're usually discussing pretty meaty topics when you're doing those emergency meetings. So this is certainly also a good plus, good benefit of COVID, if there is one. Any objections? Okay. Thank you. So we will plan to meet in September in person, right?
Yes.
All right.
Someone will need to send me driving directions. I'll probably not remember where the building is.
GPS.
Okay, recruitment of advisory committee members. David.
Sure. So there are different advisory committees for each of the professions, and the advisory committees meet in the off months in between board meetings. And advisory committee members may serve up to 4 two-year terms. And we had a number of the advisory committee members who either had reached their maximum length of service or had decided to step away from their advisory committee membership. And so we reached out to each of the chairs of the advisory committees to see if they wanted to have the BSRB send out a message to licensees for that profession to see if they would be interested in serving on an advisory committee. I should also mention too that there are spaces on the advisory committees because those advisory committees could be bigger than some of them are currently made up. And so that's kind of the different things that were put into play here. But the chairs were consulted, and we did go ahead and send out letters to licensees for the different professions. 5 of the different professions, licensees received those letters, and we have been collecting those based on the chair's preference in terms of when we want to have the cutoff. Some of those cut off on Friday of last week. Some of them are going to be cutting off this week, and then another one will be cut off, I believe, on the 19th of July. So far, we have heard back from 48 individuals with an interest in serving on an advisory committee. And so we are collecting all of those, and we will be forwarding that information to the chairs of the advisory committees for consideration. But it's been very, very positive, and a lot of good messages from licensees in terms of their interest, in terms of helping out the BSRB and discussing some of these important topics.
Hey, Dave, can you give us just kind of a round number on how many per profession?
Sure.
Just out of curiosity.
So in terms of total licenses, the social work profession makes up, I want to say, about 56% of all licensees. So they are the biggest pool of licensees, and they have had the biggest response so far. And their cutoff date was this past Friday. So for that group, we've had 29 individuals submit materials for consideration. So far for addiction counseling, we've had 4. For licensed psychology, we've had 4. Master's level psychology, 5. And professional counseling so far, 5. So we'll continue to collect these, and then as those due dates come due, we'll go ahead and collect those and then forward them to the chairs of the committee for their review. And this is not, this was a method to try to allow licensees to express their position to be helpful. And we really appreciate that. It doesn't mean it has to be the only way that advisory committees can add members. If there are advisory committee chairs who believe individuals might be interested in serving or be a help, I know some of the advisory committees talked about having an effort to have more diverse positions in terms of memberships and have spread geographic regions across the state, diversity in terms of a number of different factors like race and age, but also in terms of highlighting certain fields that they wanted to have members to. So this was one method that I think it's a nice gesture to go ahead and collect feedback from those licensees and to see who's interested in serving. But it doesn't have to be the only method. And so it's a good thing right now. We're collecting that information, and then there'll be other options to add advisory committee members in the future. But that's where we're at currently, is those 47 people who've responded so far.
Thanks.
Any other questions or comments? All right, David, thank you for your help on that. Next item, board governance policy from 2011, distributed for review for a future meeting.
Yes, and this is a document in your packet. It is a board governance policy that was adopted by the board some time ago. So on the header, it says it was adopted back in October of 2011. And some of the provisions in this document were adopted by the board back when it functioned a little bit differently than it does today. So given the amount of time since it was adopted by the board, we wanted to distribute that copy to board members. So between now and the September meeting, you can review the information that's in there. In between now and then, what I will do is I will go through this document to try to look at items on here that could be updated based on how the board functions currently. I'll try to identify items that potentially could be changed. And then in September, one option could be that you could go ahead and essentially reaffirm the board governance policy with those updates or changes. And so I wanted to make sure that you received a copy of it so that you could look through it, and it could be further discussion perhaps at the September board meeting.
I will say I'm looking forward to that. It seems like we've had this in front of us for a couple years. I had it actually saved on my desktop for about a year and then finally removed it because we're getting to it again. So I'm looking forward to the way we're going about that. I like that, David, because it is such a large document that it was a little overwhelming. So I think if you're giving us ideas on changes, that will be perfect. I was wondering how we were going to present that in September. So I really appreciate that. Again, because it's been a long time that we've kind of been trying to review it, but then COVID happened. So I appreciate that.
Sure, no problem.
Any other comments? Okay, next item, aligning expiration dates for multiple licenses.
And I can speak to this topic. Deb. So one thing, when the legislature asks us questions, sometimes they will ask us, how many licenses do you have under the BSRB? And we will say, you know, there's 7 different professions and we have this many individual licenses, but we always let them know that doesn't mean that many people, because there are some individuals who have more than one license. And one question that we had received was, would it be possible to have all of the expiration dates, if you're a practitioner who has multiple licenses, could there be a way that you could line those up so they would all be coming due in the same month? And I see the benefit of doing that. We talked with our legal counsel to see, in terms of the practical ability to do that. I think one of the issues is that we, as a agency that is put together by the state, we are held to our statutes, and that gives us authority to do certain things. And based on our statutes, it gives the length of time for those licenses. And so we have a 2-year licensure cycle, and most of them are 2 years from when you apply for licensure and are approved. The other license psychology a little bit different, because those all come due in June of even numbered years. But because those terms of license are set in statute, the board really doesn't have statutory authority to sync those up, because that would change the length of licensure. Even if someone wanted to give up several months, based on my review of what the statutes say and based on talking with our legal counsel, in order to do this, it would require a change to the practice acts for the different professions, so that we would have the ability, with a licensee's permission, to go ahead and make that change. So the short answer is that right now we lack the statutory authority to really do that, although I can see the benefit of that. If this is something the board would want to consider in the future, it would require several changes to statute. And so that could be something to be discussed. And we could talk to the revisor's office to see how many things would need to be changed, but that would be what would be required to do this. And to see the impact of who this could potentially help, we did go ahead and talk with the Board of Healing Arts, which does our licensure system, to try to get a number of how many individual persons have multiple licenses under the BSRB. And we had requested a report. They provided some information to us that of the 14,100 permanent licenses under the BSRB, there's about 1,100 individuals who have multiple licenses. The most licenses any licensee has is 3, but the majority of those that have more than one license have 2. So that's the information I wanted to provide to you, just to address some of those questions. So it practically could be done if a statutory change was made to several different statutes. But right now, the board really doesn't have the authority to sync up those dates right now.
Just to add something too, I think we should talk to those licensees as well, or try to get their opinion on that as well, if we could, if we end up looking at changing that.
Yeah, and I should tell you too, those 1,100 people, we didn't look through all of that data to see if their licenses are already in the same month. If they initially applied for both of them and were approved at the same time, they would already be aligned. So I don't know how many of that 1,100 have separate months or would want to have that. But those are the numbers as we were able to pull them.
Does the board want to discuss this further at a future meeting? Do you want to think about it? Do you want to?
I would like to continue discussing it, whether that's today or a future meeting. I think it makes sense to align people's expiration dates, and the more accurate data we can have in our database, I'm all for.
David?
Yeah, I would second that. I'm one of those people, and part of it has to do with, too, the expiration of CEUs. If your license are months or a year apart, and CEUs you take that can be used for one license can't always then be used for another license that comes due, even though they would have been able to have been used had the licenses expired during the same or a similar time period.
We need to think about also expense to the licensee if it's the same time, if they have 2 or 3 licenses, just to throw that in there as well.
Sure. My question would have to do, so I'm an addiction counselor. I always expire in July. If I were to get, let's say, a social work license in the future, then how would that work if there's this expectation that we're going to align things? So let's say I finish school, take my test, everything, I'm good to go, and it's October. Now what?
I think those are very interesting and good questions to ask. One thing is, to align them, I think it'd be very difficult for us to add months onto somebody's term in order to link them up. So I think I can't think of another way to do it except for to have someone voluntarily choose to give up months as part of their licensure cycle first time. There may be other ways to do it. That's just if this was something the board wanted to pursue, that's one way to do it. So you would be potentially sacrificing some time the first licensure period, and then after that, it would run at the same time.
I also understood that it was not mandatory, it would be voluntary. If you wanted to do it, you could, but you weren't required. That's how I understood the whole discussion.
That makes sense. So in my example, plus I'm every other year, of course. So let's say it's an off year, then theoretically I could say, well, I'll just go ahead and renew my social work license in July of next year to coincide with my addiction or whichever. But it would
Yeah.
have to be shorter, not longer.
Right.
Or
Yes.
if there's a way to explore other possibilities to see if it's possible. I mean, I think that the end goal is just to make sure that we have accurate, as best that we can, accurate data in our database at any given time.
Yeah, and I think the data is good. I think what I've heard from individuals is that the concern is that to make sure that they don't accidentally forget an expired license. If they knew that their licenses are always going to be expiring in May, they might want to sync them up so that way they know that May is the month they would have to pay. So right now the database does have the different expiration dates in there accurately. It's just more of a, would it be a helpful service for individuals of the public or licensees if they were able to sync up their licenses, and just the practicality of doing that, I think.
Did you, David, say something about that the licensed psychologists all came due at the same time?
Yeah, the licensed psychology, that license is a little bit different. So all of those practitioners, their licenses become due in June of even numbered years. For all the other professions, it's really 2 years from when they were approved, with the exception, I believe, of, I mean, this was when they were approved, but I believe that there is a large group of addiction counselors that all came in together when they were originally able to come in. So it is when they were approved. It's just, it's not spread as evenly because of when that occurred. And so that group will be expected to continue for a while.
So to Deb's question then, if somebody finished school and the other requirements they needed to become a licensed psychologist, the end of an odd numbered year and were licensed, then they have to renew the following.
There's some people that have psychology licenses for a very short period of time, for like 3 months before they have to renew again.
And the CE requirements are prorated. So if I get licensed in January of 2022, my license is going to last for 5 months, and I will have almost no CE requirements for that renewal period, right? But and then the next one it kicks in that I have to have the full CEs. So
I appreciate the clarification.
The fee isn't prorated though.
of course not.
When you consider the data, that there is a burden on staff of having all those at the same time for the psychologists, that they all come due at June. You know, that boom, here's all the psychologists. Although you've got the data of how many of the psychologists that we have, well, there's only 900. It's very hard on the staff to renew all those psychologists if you're thinking about syncing everybody up in June.
And
Every other June, excuse me. The other thing that I wanted to add is the vast majority that have 2 licenses are LCACs.
This is Janice. I was going to say other agencies who, the way they sort of do it is that you don't do yours this way, but it's when the license is renewed, are usually dependent upon like the first letter of your last name, sort of like when you get your tag for your vehicle. If your last name is AB, then in January you renew. If it's CD, then it's February. That's one way to do it. Others will do it such that your renewal date is the month of your date of your birth. So if you were born in August, then August is the date you renew your licenses. So there's ways to kind of do that so that you can, if they're going to group them together so that you can kind of stagger them out, and it won't really matter what kind of license they have. That won't be the determinant factor of when to renew. It's more like your name or your birth date, your birth month. So that's something to consider. We'd have to go back and, you know, when we talked about this with David, is like, yeah, you could do that, but we'd have to go back and look at your statutes to see what they need to be amended and so forth. Because some of them do have sort of much like you do, if they apply to get a license and they're not going to get a full year, then prorating that license. So, you know, there's other statute or other regulations. I think I want to say they're in regulations for other agencies. You could go back and look to see how they're doing it and look at their statutes. But, you know, you'd have to decide that if you're going to, you know, it might be kind of difficult to give people the choice, because then it's going to be maybe harder to follow through which ones have decided to do this and which ones haven't. But if you're going to do that, you're probably going to have to give some time to get, if you're going to do it by regulation, to set this all up so that your regulation is in effect. Because usually you're going to, let's say, if you want to start doing this for next year, then you might want to make a regulation and it would say effective July 1, 2022. Then this is the expiration date, so that if they renew now, then they're just going to be, you know, it's going to be difficult because now you're trying to switch horses in the middle of the race. So it's going to be difficult. It's going to require a lot of planning on how you're going to have to do that and how you want to pick those expiration dates. You're going to need a lot of lead time is what I'm saying.
Mm-hmm. I really like what you just talked about. Like, I love the birth month idea. Not only does that spread it out for staff, but it also helps people remember. And then if I have 10 licenses, they're all due in my birth month. Obviously, there is still a financial impact. I'm glad we lowered the fees. So.
And you use your birthday money to renew your license.
There you go.
From
Hey,
your
I didn't
birthday
think
card.
of that. I need money for my birthday.
Yeah, happy birthday from the board. Yeah, I agree.
And if you forget your birthday, or that would be pretty embarrassing. I think that I like the idea too, really. But it sounds like it's going to take a lot of time, and there will be a lot of confusion at first with any change.
So going back to, I think, Leslie's comment about soliciting input from those that have the multiple licenses. What do you guys think about David drafting a letter to those folks and inviting them to give us input in writing?
Even if it's like a little survey or something, sending out over email, I think that would be, you know, giving them the opportunity to weigh in a little bit.
I like the survey idea.
Because at this point, I'm not sure what the downside is besides an earlier renewal and the financial hit of having to do both at once. But if the majority don't want to do that for that reason, then I think we need to listen to that.
I also think leaving it voluntary is important so that people that don't want to do it don't have to.
Well, except Jan's thing really wouldn't be. I mean, it just depends on what we decided. To me, Jan's recommendation was a complete overhaul.
By doing it by birth month and yeah.
Like driver's license.
I do like that idea. Yeah.
Or car tags or whatever. Same kind of thing. I like that a lot. I really do. I love the simplicity of it on multiple levels rather than all the different ways that we do it. All right, so is that the next step for the board? Direct David to send some sort of letter or survey out. We'll get input, we'll discuss it at the next meeting. And if we decide to proceed, then we can talk, I guess, at the off-site meeting about some details about trying to move forward. Sound good? All right, I believe executive session is on the next item on the agenda.
Yes. And I have a motion here for an executive session. And so I will go ahead and just read this language. And then if a member of the board would like to make this motion, once the board moves to go into executive session, we will keep the YouTube stream going. And you should have received a message on Friday that had the conference call information for that executive session. So go ahead and use that number to enter the executive session. What I'll be looking for right now is just a certain amount of time that the executive session may last. And maybe I'll ask this of Jan, if you have a time in mind that you think it might be helpful to discuss the issues and have the board discuss the item for executive session.
You're muted. Jan, you're muted.
20 minutes, do you think that would cover it? I know, was that enough when we discussed last Friday, kind of what we wanted to talk about?
I think so. How about if we do 25 minutes and then I'll set it for 12:20. That way, a little bit of time for people to switch over to that executive session.
Okay.
Comfort break before?
So we come back at 11:15 or 11:20?
Well, it's 11:55 right now. So if the board wanted to take a break before the executive session started, we could go ahead and just say to come back from the executive session at 12:30.
Wait, your break can't be a part of the executive session.
You would need to break now, come back, and then go into session. Is that what?
Yeah, your break. If you want to take a break, you can do it either before executive session, but it can't be during the executive session. Executive session is executive session.
Okay.
All right, let's take a 10-minute break, come back at 12:05, and then we will pick this agenda item back up. Sound good?
And I'll move members into the waiting room.
The executive Zoom link.
Send that message to them. Okay, I'm gonna let them back on.
Three, 5, 6, 7, 8. All right, so I see a quorum in terms of the faces, so we can go ahead and return to our item of executive session. And we determined we needed 20 minutes.
Yes, so for time to go ahead and make that transition, I'll go ahead and set it for maybe 12:30 for the motion.
Okay.
So 25 minutes. To return at 12:30 p.m. All right, so here is the motion, and I went ahead and I sent an email to each of the board members with the same information I sent on Friday, which has the phone line for the executive session and those materials.
Thank you.
Pursuant to KSA 754319B2, we would be seeking if a board member can make the following motion: to move that the board recess into executive session for 25 minutes and reconvene the open meeting at 12:30 p.m. The meeting will be reconvened remotely by conference call at 1-877-278-8686, PIN number 327072, and at the link to the board's YouTube channel as stated in the notice of meeting that was sent to individuals who requested notice and published on the board's website, ksbsrb.kansas or ks.gov. The justification is consultation with the board's legal counsel, Assistant Attorney General Janet Hart, and Laney Barnt might be present as well. That would be deemed privileged in the attorney-client relationship. The subjects to be discussed in the executive session concern issues with a proposed contract. Board staff who are included as a client in the executive session are David Fye, Executive Director, and also Leslie Allen, the Assistant Director. And if a board member could make the following motion.
This is Andrea. I make that motion.
Do you have a second?
This is Rick. I second.
All in favor, say aye.
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 Any opposed? All right, motion carries to go in executive session until 12:30. We'll reconvene here. Just direct you to the phone number given.
Yes. And the conference call line will stay on, but we may lose that conference call line. So if it does cut off, we will just call back and open that up again when we return from the executive session.
Sounds good.
Go ahead and start it up on my phone.
Sure.
Okay, Deb, and I got a message from Andrea. She said she's not going to be able to jump back on the call. So I think she's going to be unavailable the rest of the board meeting.
Okay, thank you. There's Laura. I believe we're at a quorum with Laura present.
Yes, I have down. We have, I believe, 8 board members currently.
Okay, I just probably didn't count myself. Okay, so the next item on the agenda is consideration of service agreement with the Office of Administrative Hearings for fiscal year 2022. So would a board member like to make a motion in regard to this agenda item? All right, let me try this. I would like to propose that we direct David Fye to execute the agreement that has come across with the Office of Administrative Hearings. Does anyone disagree with that?
I will make a motion that we direct him to do so.
Okay. Is that a second?
Second, Leslie.
All in favor, say aye.
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 Aye. Any opposed? Motion carries. Next is old business licensing database agreement for fiscal year 2022.
Thank you, Deb. And before we move on to old business, when Leslie was going through the regulations, she indicated that there was one more to be covered. She's ready to go over that information.
Okay, yes, that'd be fine. So we're going to go over the definition. Is that right?
102-3-1A. And it has additional information in there because it has related field, just to make you aware why there's more changes. So I've struck the academic equivalent of a semester hour because it's added back in later in the definitions where it's more specific and it's done alphabetically. So it it will come up again in a little bit. Number 2, well, D as in dog is also struck because it is now direct client contact. So we move on to page 2. Direct client contact means providing counseling to a client or clients in an individual, family, or group format, with interaction being conducted in person or remotely with real-time, two-way interactive audio-visual or audio-visual communications, including the application of video conferencing in which confidentiality is protected. Indirect hours and interaction that consists of email, instant messaging, texting, or facsimile are not considered direct client contact. Does anyone have anything for that part before we go on? If you go to the next page, J, as in John, extenuating circumstances means any condition that is caused by any unexpected event that is beyond the individual's control. Extenuating circumstances means a situation or circumstance caused by events beyond, I'm sorry, that's the previous definition. The new one means a situation or circumstances caused by events beyond a person's control that is sufficiently extreme in nature to result in either of the following: the person's inability to comply with the requirements of this regulation, or the inadvisability of requiring the person to comply with the requirements of this regulation. Do any of you have anything about any comments or suggestions about extenuating circumstances? If you go to the next page, 1 hour as used in this act, it's about halfway down and it has 2 question marks in front of it.
Leslie, how did we receive what you're sending, what you're going over?
By email?
When? Today?
Yeah, right before, yes, today.
I'll forward it to you.
Thank you. I don't know, it might be stuck in review limbo.
Okay. Do you want me to wait a minute then?
No, you can go ahead.
Okay, 1/2 hour is used, Jan, I didn't know if it needed to say as used in this act, means at least 50 continuous minutes. 1/2 hour means at least 25 continuous minutes. Is it important to say as used in this act, Jan? Or necessary?
Your implementing statute should cover that as to which act you're talking about.
Okay. And since we're using it for all the regulations, not just one, I don't need to put anything else about that.
Are you going to have like implementing statutes for each act then? I didn't get a copy of the regulation. I'm not in on that email, so I'm not seeing it. I'm sorry.
No, the one I wrote on the weekend was deleted, so I did it real fast.
Well, that I tell you, that is more something that it's going to weigh the board down, and so why don't we look at that afterwards about what statutes you're going to use
Okay.
for your authorizing and implementing. Because to
it
make it
was-
apply, you'd have to have something for every act.
Right, no, I'm sorry. No, it's not the act anyway, it's the regulations.
I know, but you were asking about having the regulation
Yes.
to make clear if it's to one act or all the acts. I think we can deal with that afterwards. That's more technicality.
Okie doke. And then if you go to the next page, I have this, and I would like to put it in all of the definition regulations that don't have it. It's very helpful when we review education that we have a specific number listed for quarter hours, how much they equal to in semester credit hours. So quarter credit hour means 2/3 of a semester hour. Quarter credit hours shall be rounded as follows: 1/4 equals 0.7, 2 equals 1.3, 3/4 credits equals 2.0, 4 quarter credit hours equals 2.7, and 5 equals 3.3. And that's the part of A that I struck. And then the next one, V, related field means a degree program in the helping professions and may include any of the following: education, human development and family studies, marriage and family therapy, psychology, social work, and theology. Is that what you remember, Laura? Was there anything else? I think I took out what they wanted, and I don't think we needed anything else.
No, this is solid.
Okay. And that is the end. And so I would like to use these definitions in all the professions except LBA and psychology. Are there any questions or concerns?
Board have anything?
I just want to thank you, Leslie, for all your hard work. This is really solid work, and it's going to help us to be consistent, predictable, all things that I hope make your life easier.
Thank you. You're welcome. So I do have then one question for Bruce and Rick. Client contact is not defined in psychology regulations. Do you wish for this definition to be put in your regulation or not at this time?
Which definition is that?
Client contact.
Direct client contact?
Direct client contact, sorry, yeah, direct client contact. I mean, any of them, but yours doesn't really have, it does have a definition of clinical contact, which may be direct client. I'm not sure exactly the language, but it doesn't have anything about the televideo and things like that, excluding texts and email or facsimiles and things like that. I don't know if you would like to take that to your committee so it can be discussed, or if you had an opinion on putting that in there.
I'm trying to look at the supervision. It would be in the
Okay.
supervision statute, right?
No, it would be 102.11,
102.
11A probably.
While Rick's doing that, Leslie, I have a quick question. Under
Uh-huh.
extenuating circumstances, who is it that determines that
The
the
board.
situation meets that criteria?
The board.
Okay.
Although we've delegated that to David.
Right. And I don't know, maybe it needs to be as defined by the board somewhere in the definition.
Yeah, I just wondered because as you read it, it doesn't, it might leave it up to interpretation that the supervisor or other person could say, yeah, I think that's an extenuating circumstance.
Okay. I'll put the as determined by the board or approved. I can call you later, Rick. I just want, if you
Bruce?
wanted.
Yeah, thank you. Bruce may have a different opinion, but my initial thought is I'd like to have the advisory committee weigh in.
Okay.
I agree with that 100%.
Okie doke.
Leslie, can you get them something in writing for them to
Yes,
have that? Perfect. Appreciate it.
I'll send them, I'll do up your definition regulation for you for your next meeting.
So any objections to us directing Leslie to proceed with the definitions? Getting those aligned and revised. Okay, so I think we're ready for the licensing database agreement.
Yes, so under the first old business item, when the board met last time, we mentioned that we were reviewing a contract. It's an agreement by the Board of Healing Arts to continue their facilitation of the online licensing database system. We call it IMLO, My License Office. So that the last time the board spoke, I went forward from that meeting and did have some more communications. The board did vote to authorize me to reach an agreement with that entity and continue contract negotiations before that. So I did. I went ahead and spoke to them and expressed that it was important that we have some additional language added to the contract. And so through the negotiation process, we did have some language added that during the next fiscal year, it would be understood that we would begin the processes of converting disciplinary and enforcement data into the IMLO system. So we'll be moving forward on that for the next year. And also it was important that we go ahead and begin to have our initial licensing moved over to the online system as well. I think it's going to be a big benefit for licensees. So we add some information in here that during fiscal year 22, we will begin the initial application process in the eGov system. Now they did ask that there be some language included here that doesn't make it a guarantee that we will be finished during the next fiscal year. And I thought that was reasonable given the fact that we're going to be doing the disciplinary system and the initial licensure system. So the understanding is now we'll be moving forward with both of those in fiscal year 2022, but there's not language guaranteeing that both will be finished. We'll try to prioritize those and get them moving. And then my hope is by the next fiscal year, that will be something that we have completely in there in terms of the initial licensure. So I'm excited about that. As a reminder, the cost of the agreement was the same cost that we had paid the previous year. And so I went ahead and after that language was negotiated into the contract, I went ahead and signed and they signed it as well. So we now have agreement in place for fiscal year 2022.
All right, thank you. All right, so as we look at other legislation that was passed this year and implementation concerns or process, David, you're going to talk about HB 2066.
Yes, and so House Bill 2066 is the bill that expedites the licensure review and approval process for certain military members, military spouses, and other individuals. The bill talked to people who, this is going to concern reciprocity applications. And there was some language that this bill would affect individuals who are residing in Kansas or seeking to reside in Kansas. And so we've had a meeting with other small agencies who are struggling with the regulatory changes for this bill as well. The language in the bill says that rules and regulations shall be implemented by the agencies to facilitate the adoption of the provisions in this bill. We have reached out to other agencies to try to make sure that our regulations are consistent with what other people are doing. It doesn't make sense for us each to be interpreting these things differently. We have talked with a few who have submitted some temporary regulations that are in the process of being approved but have not been approved yet. So the bill calls for tracking of these specific cases to begin as of July 1st. The bill was effective upon publication of the statute book, which was, as a technical matter, deemed to be when the session laws were published by the Secretary of State, and that did occur on July 1st on the website. So the bill is now effective. We did post notice on the BSRB website of that date. And we made, Leslie made adjustments to the reciprocity applications so that we can collect some additional data to make sure that we keep track of who is applying under the provisions of 2066. The bill indicates that over the course of fiscal year 2022, we would keep track of which individuals apply under the provisions of this bill, and then how quickly those applications are processed. So we're tracking the time of when those applications are received, and then when the file is considered complete, and then when the license is processed. Now, our licensure process is different from some of the other regulatory bodies. And so those timeframes might differ based on what needs to be included, and also in the way that our fees are processed. But we are trying to make sure that we are keeping track of them. So Leslie did modify the reciprocity applications. We are now asking all licensees who apply on the provisions of this bill, if they are military members or military service members as defined in the bill, if they are military spouses, if they are residing in Kansas, we can tell by their licensure information, or if they are intending to reside. One of the biggest issues is that intent to reside language. We've talked to the reviser of statutes to see if there's any similar language in any legislation, and they have indicated that to their knowledge, there's not a similar provision for the intent to reside. So that may be something that the board may wish to look at in terms of regulatory language in the future. What we have done right now is we've included language that if you are intending to reside, please explain. So we're trying to collect data to be in compliance with the statute. We are moving forward on some of the regulation language to be consistent with the other licensing bodies that are implementing this bill. And we are tracking. We've talked to the individuals with the Board of Healing Arts to make sure we have things in place so we can begin tracking these individuals when they apply. So we will have some additional information to bring to the board in the future. Right now, we're just wanting to let you know where we're at with this, tracking and processing these applications and trying to expedite them as best as we can in line with the timeframes that the bill put forward. Again, it is a really complicated bill. There's really not consistency between the regulations. No entities have had the regulations officially through the rules and regs process. But we're doing our best to be in compliance with the provisions of this bill. I just wanted to remind the board too, when you had one of those short board meetings specifically about this bill, one of the products from that meeting was you directed me to introduce testimony at the bill hearing for this bill and suggest amendments. And one of the amendments that you asked to have suggested was that the implementation date be delayed until January 1st of 2022 to allow appropriate time for these rules and regulations to be fully fleshed out to make sure that we understand what all needs to be added here. That amendment was not adopted, so we are trying to move forward as best we can while trying to go through the statutory requirements and the regulatory process. But that's what we can update you on today. The information has been made public. We are doing our best to be in compliance with this, and we are tracking as according to the statute. And we'll have more regulatory language for you to review probably at your next meeting in September.
Okay, thank you. Any questions for David on that? We're trying to make lemonade out of those lemons. SB 170, David?
Yes, so Senate Bill 170 was the bill that would ultimately become the SIPAC legislation. That's not the only item in there, but in terms of SIPAC, that is the multi-state compact, which allows licensed psychologists to practice teleservices in compact states. And there's also an additional option that they could apply to through SIPAC to do a limited number of in-state days of practice. And when the legislation was going through the process, there was discussed that the SIPAC Commission had decided as one of the implementation steps is that any individual who chooses to practice under SIPAC and provide those telehealth services, anyone who does that and lists, let's say Kansas as their home state, SIPAC would, at the end of the year, look back at how many individuals that was and would charge a yearly assessment to the state of Kansas totaling $10 per person who chose to practice in SIPAC who listed Kansas as their home state. And so when the bill was going through the process, representatives from the Kansas Psychological Association who were supportive of the compact provided some language for the legislature to consider. And this language indicated that the board, the BSRB, may assess a fee at the time of licensure or licensure renewal for any person seeking compact privileges to practice under the Psychology Interjurisdictional Compact, which is also known as SIPAC, whose home state is Kansas, in addition to any other fees authorized by law for licensure, not to exceed $25. And then it says the board shall adopt rules and regulations to establish the amount of the fee. When the board met earlier, the statute was still pending adoption. Well, now that the bill has been signed into law, and I should mention too, the effective date of the provisions in the bill are January 1st, 2022. But I've been in conversations with the executive director from SIPAC, Janet Orwig, and we can go ahead and do certain things ahead of time to set them in place. One of the items the board, this was brought to the board's attention at previous meetings, but the bill had not become effective. And so now that the statute has become law, the board has the ability to choose to implement a fee to recoup the cost of that assessment, more or less, up to $25 at the time of initial licensure or renewal for those licensed psychologists who choose to participate under the SIPAC. And so I can answer any questions on that, but now that the bill has become law and that the language did call for the board to adopt rules and regulations to establish such a fee, now is the time that we can come before the board and ask the board for discussion or consideration on if you would like to set that amount for the fee and how much you would like to set that amount. I know in previous discussions, the implementation of this was discussed. One of the discussion points was that one of the possible times that you could recoup this fee would be through the renewal process, because the assessment looks back to see, did you actually practice under SIPAC? The renewal could ask a question such as, are you practicing under SIPAC or are you intending to practice under SIPAC? And so it could also look to see, are you someone who's going to be eligible that we would be charged a fee in terms of this assessment? And then we could recoup that cost more or less in terms of it. It would be helpful for the board if it was a flat fee. So that way we wouldn't have to keep track of partial years. But that's kind of what I want to bring to your attention to see if you wanted to go ahead and have that discussion now to set that fee, or if you would like to set the fee based on that language.
Brewster Rick?
Clarifying
Oh, so go
question.
ahead, David.
Is this for psychologists licensed in Kansas who are going to practice through SIPAC in other states?
Yes, so under SIPAC, if you want to participate under SIPAC, you would apply to the SIPAC itself for the e-passport, and you would list what your home state is. Every person who practices has to identify their home state. And so you may be licensed in several states, but this would allow you to practice in any of the SIPAC states under the teletherapy. But based on where your home state is, that's the state that would be assessed the yearly $10 assessment by SIPAC. And it is for licensed psychology.
So we're going to collect from that group of providers and then turn around and give some of that money to SIPAC.
That's correct. Well,
Okay.
kind of in reverse.
Exactly.
SIPAC is going to send us a bill for every psychologist in Kansas who is in SIPAC, whether that's 5 or 500. And so we were going to get a bill not to exceed something. I can't remember the worst case scenario. But at the minimum, in my opinion, in the minimum, we need to assess at least $10 so that we're not losing money on SIPAC.
Yep.
And we had also, and I can't find it now, someone had collected some information on how much time investigations cost for us. Can someone help me remember? Did someone just send us something on how many person hours that David? Yeah. Okay. I thought maybe I was going nuts for a second.
That is from the draft of the minutes from the previous meeting. I believe it's on page 6 under
Yes.
170. The last line indicates that we had asked our staff to determine the average amount of time to investigate a complaint against a licensed psychologist. And based on everything included in that process, they said the average time is about 9 hours to investigate.
Thank you. I'm so glad you found that because I was really worried that I had dreamed it or something, but yay me for reading the minutes and yay you for confirming that
Yeah, and also too the assessment, we have been informed that SIPAC assesses this to the states in place of essentially a membership cost to be in this multi-state compact. They discussed the option of having a flat amount per state who's in the compact, but they thought it would be preferred to have an assessment based on how many people choose to participate, which is why they're using the $10 assessment.
Okay, so let me just say this is Rick, so just some initial thoughts. So an easy approach would just be to do a flat $10, and that way we're not losing any money unless we have investigations that need to be engaged in, right? And so another approach would be to make that dollar amount something like 15 or 20 as an insurance policy against any investigations. I can't do all the math in my head, but my recollection is that somewhere between 5 and 10% of investigations by the CAC are for licensed psychologists, right? I think that's accurate.
Yeah, well, just one little correction too, that, the assessment would be a yearly assessment and our licensure is every 2 years. So we would be, if someone practiced for 2 years, we would be assessed a $20 assessment, and we would probably be collecting this upon renewal. So that would be every 2 years. So it's a 1 year versus every 2 years as well.
So we collect this every 2 years, but so $20 is that would be the minimum for us to recoup what we're getting. Oh, okay.
Yeah, because they would assess state of Kansas $10 per year that someone practices under SIPAC, and Kansas is their home state. And we would collect our licensure fees every 2 years. So
then I would vote for 25, which puts a little bit of an insurance in there in case we're having to do some number of additional assessment investigations beyond what we're currently doing.
This is Carol, and I agree with Rick. 25.
I'm okay with the 25. I don't see where we need to necessarily set us up to lose money on this, or it'd be an extra expense that we can't recoup somehow.
Okay. Would someone like to make a motion?
I move to set the fee at $25 at the renewal every 2 years.
I second it. This is Carolyn.
All in favor, say aye.
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 Any opposed? Okay, motion carries. Setting it at $25.
David, this is Rick. Could I ask just a question about websites? Is it possible that we could have a note on the website that addresses that so that licensees will know why that is assessed and what that money goes to? Whenever the time, and we don't have to do it, obviously this month, but someday it might be nice so that when someone says, why am I getting assessed $25? We can say, because SIPAC is charging us and we're hedging our bets that you're not going to do something that requires our investigation.
Sure. Yeah,
Nice.
we can go. Yeah, we were kind of lining up the announcement of the bills with their effective dates to make them kind of timely so people would know. But now that the board has taken action on SIPAC and there's one other item for SIPAC, we can go ahead and post that to just kind of give them some advance notice on that.
You're going to have to be doing a regulation anyway to tell them how much to pay. So, I mean, putting it on there now, they're not actually required to pay the $25 till we get the regulation going.
Yeah, and the next renewal would be June of 2022. So we'd have a little bit of time before then.
Okay, I think the second item was selecting representative for SIPAC Commission.
Yes, so member states of SIPAC are asked to designate a representative for the commission, the SIPAC commissioner from that state. And that person would take part in meetings of the SIPAC commission. They meet annually in November. I've been informed this year there's going to be another one in July. Even though we don't officially become part of the multi-state compact until January 1st of 2022, the SIPAC executive director, Janet Orwig, indicated if the board wanted to, they could go ahead and name someone to serve as commissioner, and that person could participate in the discussions at the meetings. They just wouldn't have voting authority until we actually were in the compact as of January 1st of 2022. The Licensed Psychology Advisory Committee did meet since the last board meeting when we had received this information, and they discussed this topic at that meeting. And they did go ahead and make a motion to recommend that I serve as the Kansas SIPAC commissioner on behalf of the state of Kansas. So I just wanted to make you aware that that had occurred between when we received this information and when you got a chance to meet to talk about this as well. Just as a little bit of also some additional information, the majority of states that participate, the person who was named as a SIPAC commissioner, majority of states do name the person who's the director of their licensing body, because I did ask to kind of see, was this the normal process or how is that determined? And every state can determine according to sort of the information you have in that letter in your packet. But the majority of states go ahead and have someone who's the director of the licensing body go ahead and serve in that function.
The advisory committee just felt like that made the most sense, given David's familiarity with the regulations and his role as an executive director.
Yeah, ultimately, this decision is for the board to choose who they want to serve as the commissioner, but that was a recommendation the advisory committee made, and so I want to make you aware.
Do we need a motion?
I just go ahead.
I think a motion would help clear it on the record in terms of who you would want to have selected, or if you would like to decide at a different time.
I would defer to Rick if he'd like to make that.
I move that we appoint the executive director, David Fodley, as the commissioner to SIPAC.
I'll second that.
All in favor, say aye.
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 Any opposed? Motion carries. Thank you, David. Update on contracting with licensure review company.
So at the last board meeting, Tammy Lee, who is with the Center for Credentialing and Education, presented information to the board. She's with a company out in North Carolina that can do certain licensure reviews for individuals who receive their education from a non-accredited or a school that's not accredited by the national accrediting body, non-KCREP in this case. And the board authorized me to continue contract negotiations to try to reach an agreement. I did go ahead and submit some information to that company to ask if we could get a different type of contract with some different provisions. They sent me another version of the contract. I forwarded that to our legal counsel to review and make some additional, see if that was going to work out, if we needed conditional changes. And they sent a version back to me with some additional modifications. So I just wanted to update you, let you know we are still in the contract negotiation process. But in the meanwhile, we've continued to have discussions with individuals here in Kansas to see if they could serve as an expert witness for the state for doing some of these licensure reviews. I want to let you know that I believe we're very close to reaching an agreement with someone to serve in that capacity. And so I believe we'll be able to reach an agreement with that person here soon. And so much so that I think we might be able to have that person do some of the reports for the CAPA session at the end of this month. So I don't want to create unreal expectations, but that has been a very positive thing. And so I want to let you know where I'm at with those things.
So you'll just keep us posted on the other contract.
Yes.
Okay,
I'll continue to negotiate with both. So.
thank you. Complaint Review Committee. You're muted, Bruce.
I didn't have that screen up. Okay. There's 2 reports there for you to look at. We had a few more cases in June than we've had in the past, but overall, it's not tremendously different. The committee continues to do a lot of good work. We process a lot of cases through the committee, and I think we're all doing a good job. Are there any questions? If not, that's our report.
All right, thank you, Bruce. Professions reports, psychology.
Thanks. The Licensed Psychology Advisory Board met on June 8th. We've already really talked about most of what we discussed. One of the items was the SIPAC commissioner role. We also discussed advisory committee reports. So those were probably the 2 biggest, the advisory committee members. And those were the 2 biggest items on our agenda for last month. We meet again, I think, next month.
Okay, thank you. Social work, Carolyn?
Yes, the Social Work Advisory Committee met May the 18th, Tuesday at 1 o'clock. Old business, we discussed the board-approved clinical supervision or supervisor for possible 2022 legislation. I think that we're just putting that out on the board for topics. We did discuss maybe having another survey since the last survey that we sent, gathering input from LMSWs and LCSWs was done in 2015. So we thought it might be kind of good to get people's opinions on this. New business, we talked about methods of how updates could be sent to advisory committee members of legislative hearing information, such as dates and times. Another survey since the last survey that we sent, gathering input from LMSWs and LCSWs was done in 2015. So we thought it might be kind of good to get people's opinions on this. New business, we talked about methods of how updates could be sent to advisory committee members of legislative hearing information, such as dates and times. Another survey since the last survey that we sent, gathering input from LMSWs and LCSWs was done in 2015. So we thought it might be kind of good to get people's opinions on this. New business, we talked about methods of how updates could be sent to advisory committee members of legislative hearing.
Sorry, we're getting some feedback. If anybody has the YouTube stream up, you might want to go ahead and mute that. Sometimes it'll be on a little bit of a delay. So
Yeah, I'm confused. I spoke and then I heard a recording of my voice. Am I okay to continue?
It's better, yes.
Yes.
Go.
Yes.
I was a little confused as to where I left off. Let's see. We also discussed creative legislative solutions on the distribution of social workers in the state of Kansas and some of the more at-risk areas such as rural communities. We discussed a little bit about records of deceased practitioners. And I think as a reminder, we talked about what we should do if any advisory members were contacted from licensees, and that we should always report these to David. Basically, that's just a quick overview. Our next meeting is August the 17th, Tuesday at 1 o'clock.
Thank you. Professional counseling. Laura?
I'm so sorry about that. The Professional Counselor Advisory Committee met on June 7th. And we've covered a lot of what we discussed. A lot of the bills and so forth have already been discussed during this meeting. Some of the business that we tabled for our offsite September meeting to happen is retention of disposal of practitioner records, and then changing or amending the CE requirements for diversity, equity, and inclusion. New business that we had that I think is going to really take up a lot of our time in the future, which is good. We had Kylie Dotson-Blake from the NBCC come and speak to the committee about the compact, the counselor compact that is in the works nationally. At this point, only 2 states have adopted that compact, and we had a lot of questions for her. Some of the things she had to say about the compact were not compelling. One of the things that she said that we had concern about is that in this compact, that there no counseling degree is required, no master's level degree. So we had a few concerns that I could tell most of the committee were stuck on, understandably. So David has agreed to reach out to the Committee for State Governments, and he's been trying to get an appointment with them that we can attend so that we can talk to other state governments and find out how they're working with the compact and what their concerns are as well. And so we have just, this is really just the beginning of a dialogue about compact. And so we spent a lot of time on that. I thought it was good discussion. It opened a lot of questions. And our next meeting will be in August.
Okay, thank you.
Thank you.
I don't believe we have a marriage and family therapy report unless you received something, David.
No, I did not. And there's also the master's level psychology that was right above that.
Oh, I'm sorry. My pen got excited about scratching it down. David?
Yeah, we met on June 17th, and I think our next meeting's currently scheduled for August. We've got a couple of members that we're looking to rotate off, and I think our invitation closes tomorrow. One of the questions I had was around committee makeup and levels of licensure. So do committees look, for those of you who have people practicing both at the independent and non-independent level of licensure, to include both groups as one of your criteria, in addition to kind of where they're practicing, both in terms of their geographic area and profession?
This is Carolyn. I know the Social Work Advisory Committee looked at those different types of practices, trying to include, if all possible, members on the committee, those in private practice and those not.
You have different levels too.
And different levels as well.
Very good. We talked a little about records of deceased providers and thought it would be important to have a manner by which licensees could identify who the custodian would be. We talked about the possible CEU requirement for diversity, inclusion, and equity. So really good discussion on that, including some general wondering about what the problem was that this proposal was trying to solve, people acknowledge that a lot of the current trainings they take often include sections on this. Also, that it's, part of our requirements to provide services only in areas or to populations that we feel like we are competent to do so, and if not, we should seek additional training. We talked about the 988 National Suicide Prevention Line and the possible impact of that on licensees' obligation to have a plan in place to deal with patients for after-hours crises. Just wanting to make sure that people didn't, as their after-hours plan say, call the national hotline. We talked briefly a little bit about how our meetings would continue, whether we would continue to have Zoom meetings. I think we're talking about at least getting together once a year so that people have the opportunity to meet each other in person and get to know each other a little bit. We talked a little bit about the post-grad supervision requirements from HB 2208 and discussed the in-residence requirements for educational qualification for licensure, particularly as it applies to online programs. That's my report.
Okay, thank you. Addiction counseling, we met on June 18th. We also discussed the matter of records of deceased practitioners. There was general consensus that we ought to perhaps add a regulation and attach to renewal as part of an audit, like what their plan for that is. Diversity, equity, and inclusion training, some discussion on that as well. If there was, I guess, intent by the board to proceed with that, they would be the most interested in seeing that diagnosis and treatment go to 3 hours in requirement, and then you could add that one in as another 3 hours. In residence, we talked about that. Mainly there was just a lot of discussion about the different ways that people learn and how do we accommodate that without sacrificing quality. We meet again on September 24th. I'm assuming there's no behavioral analyst report. So actually that comes to the end of our agenda.
Well, Deb, I know this is your last meeting as chair. On behalf of the Behavioral Sciences Regulatory Board, I wanted to thank you for serving as chair. On a personal level, I wanted to thank you because you've been a big help for me in finding out a lot of my responsibilities in terms of the different hats that I wear and just being able to get some guidance from you on different topics and discuss issues. So just wanted to say a big thank you and appreciate everything that you have helped us with.
Oh, thank you, David. Oh, very sweet. It's been my pleasure. Honestly, y'all, they're just a fantastic group of folks to work with, all of you. All right.
You're a hard act to follow. I'll do my best.
Well, I'm right here to support you. So.
Yeah, you're amazing.
Yes, and Leslie, looking very forward to working with you in the future.
Thank you. Looking forward to it.
Great.
Okay, so do I have a motion to adjourn? Or you guys just want to hang out a little longer?
So moved. I'll make the motion.
Second it, Carolyn.
All right, all in favor, say aye.
Aye.
All right, see you in a couple months, or if not
Take
before.
care.
All right.
Congrats, Jan.
Yeah, take care.
Bye.